In a bid to curb the further spread of the recent cholera outbreak in Niger State, the United Nations Children's Fund (UNICEF) has pledged to donate commodities to the affected communities. The UNICEF Chief of Kaduna Field Office, Dr. Gerida Barkila, made the pledge during an inspection visit to the isolation center at the old wing of late Idris Ibrahim Kuta Primary Healthcare Center, Old Airport Road. The reports. Speaking to journalists shortly after inspecting the old wing of the late Idris Ibrahim Kuta Primary Healthcare Center, which is currently used as the isolation center, the UNICEF Chief of Kaduna Field Office, Dr. Gerida Barkila, said their visit followed the recent outbreak of cholera in some local government area of the state to ensure the isolation center is well equipped to meet up the standard and demand of the cholera treatment. She assured the organization's commitment to collaborate with Niger State government and all relevant stakeholders towards curbing the spread of the disease.
Here at the Cholera Treatment Center, as Niger State is currently facing an outbreak of cholera in a few LGAs, like 6, and we have had 13 deaths, and most of those who have died are children. And the children actually are more represented in the cases of 297. So this place is being set up and it has been running, but we want to increase it and beef it up to be able to meet the demand and the standards of the cholera treatment center.
Speaking also, the health specialist with Kaduna Field Office, Dr. Sule Mela, said the cholera disease was identified 2 weeks ago in 2 metropolitan cities of Minna, but has gradually spread to about 4 local government areas in the state. He disclosed that UNICEF has begun sensitization to the public on ways to prevent cholera, adding that the organization is also working towards setting up cholera treatment units across the affected local governments.
We got the information about cholera outbreak in the last few weeks. It started in 2 LGAs of Chanchaga and Boso, which is largely the metropolitan LGAs of Minna, but then gradually it spread to 4 other LGAs. So we now have about 6 or 7 LGAs that are reporting cases. So far we have about over 200 plus suspected cases. 50% of them are positive for rapid diagnostic test, and unfortunately we lost 13 patients. Right now where we are standing is the cholera treatment center. We have about 9 patients on admission and 4 came in just now, and then we just heard that another one has come. So the case likely is still increasing. So, we are doing a lot of things, activities in the community, sensitizing people about ways to prevent cholera, as well as the case management of those that are suspected. They should be isolated and treated.
In his part, the Director of Public Health in the Ministry of Secondary and Tertiary Health, Dr. Ibrahim Idris, said Niger State government has embarked on aggressive sensitization exercise as well as set up treatment and isolation center to mitigate the spread.
Collaborating with UNICEF, the supporters of several items, several commodities. This is like the 3rd time they are coming doing this outbreak now, which is very commendable. Like I said, we've been working together. We are getting some advices, some support from them, and those things that for those areas that we have not yet be able to close the gap. So as soon as they give us suggestions, we always try to implement.
Pamela Duma reporting for NSTV News.